The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
We will now try to integrate the concepts and the pathways that we learned during the discussion of carbohydrates, proteins, and lipids. So first, let's review the difference between insulin and glucagon. Remember, these are the most important hormones, and you need to be familiar with them and their effects in the biochemical pathways. So this table summarizes the difference between the two. Of course, you know that both are produced by the islet cells of the pancreas. So remember AGBIDs, the mnemonic AGBIDs. So alpha cells, glucagon; beta cells, insulin; delta cells, somatostatin. Between the two, always remember, so which is the hormone of the fed state? The hormone of the fed state is insulin, whereas the hormone of the fasting state is glucagon. Now, second messengers, who is the second messenger of insulin? The second messenger of insulin, of course, is your tyrosine kinase. So remember, this is tyrosine kinase. The thing about tyrosine kinase, it is the receptor. At the same time, it is also the kinase. No? So siya na rin yung nagpo-phosphorylate. No? So you will see insulin will bind to its receptor, tapos siya na yung magpo-phosphorylate kung ano man yung kailangan niyang is-phosphorylate. In contrast, glucagon, the second messenger of glucagon is cyclic AMP. Well, let's review again. No? So glucagon, will it bind to its receptor on the cell surface? Ano sabi ni glucagon? Fasting tayo. Diba? Always remember that. Sabi ni glucagon, fasting tayo. Okay, and what will happen after glucagon binds to its receptor? It will activate adenylyl cyclase. Adenylyl cyclase, kaya siya cyclase, it will, yung ATP, i-convert niya to cyclic AMP. No? ATP is converted to cyclic AMP, which is the second messenger. Si cyclic AMP, siya yung magsasabi sa loob ng cell. Anong sasabihin niya? Fasting tayo, fasting tayo, fasting tayo. Siya yung mag-amplify ng message and will make sure that all the organelles inside the cell know that you are in a fasting state. Cyclic AMP will then activate protein kinase A. So you can see here, protein kinase A now becomes active. And what is the role of protein kinase A? Protein kinase A phosphorylates enzymes. So you will see here, a dephosphorylated enzyme will become phosphorylated. This is the reason why, anong sabi natin? No? Fasting phosphorylated. Now, always remember that. Fasting phosphorylated. In the fasting state, enzymes are phosphorylated. So babalikan natin yan later, no? Dun sa activated or inhibited. Okay? So para hindi kayo malito, remember, protein kinase A requires cyclic AMP. Protein kinase C requires calcium. Saan nyo narinig si protein kinase C? Which second messenger? Okay, your IP3 and DAG, inositol triphosphate diacylglycerol. Now, going back, okay, paano ba sila nagtatanong sa board exam? So, remember, no, ang mas important dito, yung understanding, no, of pathways increased or decreased, no? So, they might ask you, no, so, okay, so don't look at the table, just look at me. Okay, try to answer my questions. So remember, always think of the pathways in pairs. No, always think of the pathways in pairs. So insulin. What will insulin activate? Glycolysis or gluconeogenesis? Okay, of course, glycolysis, because glycolysis breaks down glucose, which is elevated during the fed state. How about glycogenesis or glycogenolysis? Right? The correct answer is glycogenesis, because during the fed state, what do you want to do? Do you want to create or do you want to break down glycogen? Siyempre, you want to create, diba? You want to store for future use. How about beta oxidation or fatty acid synthesis? Which one will insulin activate? Beta oxidation or fatty acid synthesis? Fatty acid synthesis. So during the fed state, you want to convert acetyl-CoA to palmitoyl-CoA. And then, how will you store the fatty acids? You store them as triacylglycerols or triglycerides. Diba? Triacylglycerides. Okay. Sino sino nagsisynthesize ng majority of fatty acids? Hindi yung bilbil mo, di ba? It's not your fault. Okay? It's the liver. No? And then the liver will export to the other organs. Okay? So, paano naman pag enzymes ang tanong? They might not ask about the pathway, they might ask about the enzymes. So, for example, okay, what is the effect of glucagon on phosphofructokinase 1? So, what is the effect of glucagon on phosphofructokinase 1? So, first, of course, you have to recall that PFK1 is an enzyme of glycolysis. Diba? It's step number 3, the rate-limiting step. So, iisip ka ngayon, kung glucagon, fasting. Kung glycolysis, gusto mo bang mag-glycolysis pag fasting? No. So, the correct answer is glucagon inhibits phosphofructokinase 1. How about glycogen phosphorylase? What is the effect of glucagon on glycogen phosphorylase? O think, para saan si glycogen phosphorylase? O clue. O, diba? Kagat. Kinahagat niya si glycogen. So, glycogen phosphorylase breaks down glycogen, so it's part of glycogenolysis. Therefore, when would you want to break down glycogen? Well-fed or fasting? In the fasting state, where glucagon is high. So therefore, glucagon activates glycogen phosphorylase. How about acetyl-CoA carboxylase? What is the effect of glucagon on acetyl-CoA carboxylase? So acetyl-CoA carboxylase is the rate-limiting step of fatty acid synthesis. Do you want to synthesize fats when you are fasting? No, you want to break down fat. So the correct answer is inhibited. How about HMG-CoA synthase? Para saan nyo narinig si HMG-CoA synthase? HMG-CoA synthase is the rate-limiting step of ketogenesis. No? When do you synthesize ketone bodies? When you're well-fed or fasting? In the fasting state. That's why glucagon activates HMG-CoA synthase. Okay? So, how about yung phosphorylation and dephosphorylation? So, tatandaan nyo lang, well-fed, walang phosphate. Fasting, phosphorylated. So, if I ask you, what is the effect of phosphorylation on glycogen phosphorylase? Okay, so glycogen phosphorylase, kakasabi lang natin kanina, glycogen phosphorylase is part of glycogenolysis. Diba? Kinakagat niya si glycogen. So, kung phosphorylated, we are in the fasting state. So, in the fasting state, gusto mo bang i-break down yung glycogen? Yes. So, that's why phosphorylation activates glycogen phosphorylase. How about pyruvate kinase? What is the effect of phosphorylation on pyruvate kinase? So, pyruvate kinase is the last step of glycolysis. Okay? So, kung phosphorylated, fasting. So, in the fasting state, gusto ba nating mag-glycolysis? No. That's why phosphorylation inhibits pyruvate kinase. In contrast, dephosphorylation will activate it. Because pag dephosphorylated, walang phosphate, well-fed. Mag-glycolysis tayo nun. Again, it takes some time to become familiar with this, no? But as I hope that I'm able to show you, you don't really need to memorize the tables. You just need to try to understand. Ask yourself, gagawin ko ba to pag fed state, magbagong kain ako? Or gagawin ko ba to kapag fasting ako? Is insulin high or is glucagon high? Walang phosphate, well-fed. Phosphorylated, fasting. And then, one other thing you need to remember, No? Si glucagon marami ang kakampi. Sino yung tatlong kakampi niya? Si cortisol, si growth hormone, and si epinephrine. So if they ask you, what is the effect of cortisol on gluconeogenesis? Iisipin nyo lang anong gagawin ni glucagon. Diba? So, kasi remember, cortisol, stressful situation yan. You need energy. No? So, gusto mo bang gumawa ng glucose kapag under stress? So, the correct answer is activation. So, gluconeogenesis is also activated by cortisol. Okay, so pag nabanggit yung tatlo, just remember, no? Just remember, cortisol, epinephrine, and growth hormone, they have the same effects as glucagon. The feed-fast cycle. So in the board exam, they always, one of their favorite questions is a person who undergoes either fasting or being well-fed. Pero mas madalas yung fasting. So they usually give you scenarios. So iba-ibang scenarios yung mga binibigay nila. For example, a Muslim during Ramadan. Or for example, a priest during Lent decides to go on a fasting. Or a student who goes on a hunger strike. O kaya may mag-girlfriend-boyfriend, nag-away sila, hindi sila kumain kasi hindi sila nag-uusap, hindi sila makakain. No? May mga ganong scenario. Kung kahit anumang, regardless of the scenario that they give you, you just always need to remember the time points. No? So, you need to be very familiar with these two graphs. So, these two graphs, yung x-axis, no, tells you the time. No? So, let's look first at the graph on the left side. So, this graph shows you, no? So, what will be your energy source after eating? Okay, this graph tells you where you get energy after eating. So sabi dito, no, look, during the first 4 hours after a meal, so makikita nyo to, look here. So during the first 4 hours of a meal, this is your fed state. What will be your source of glucose? So remember, no, glucose is the preferred fuel of your cells. So during the first 4 hours after a meal, yung ingested glucose. Okay? The food that you ate will provide you with glucose. So, kunyari, kumain ka ng 8 o'clock. From 8 o'clock to 12 noon, you will get glucose. Your cells will get glucose from what you ate. Now, after 4 hours, sabi natin, you now go on fasting. Fasting state na. No? You now go to the fasting state. Hindi ka na kumakain, so you now need to find sources of glucose. Okay? So, what happens? Saan na tayo kukuha ng glucose? You will see on the graph, ang una natin gagawin, we will break down glycogen. So, in the first 24 hours, glycogen muna yung uubusin natin. Okay, where did we store glycogen? Liver and muscle. So, in the liver and in the muscle, you will now break down glycogen to glucose. So, remember the enzymes, no? So, which one will distribute glucose to other tissues? Liver. Which one will use glycogen for itself? No? So para sa kanya lang yung glycogen? Muscle. No? So if you remember, what's the end product of glycogenolysis in the liver? It's free glucose kasi kailangan niyang ipamigay. Pero sa muscle, it's glucose 6-phosphate. It does not remove the phosphate kasi pag tinanggal niya yung phosphate, lalabas si glucose. Now, the other thing you need to remember, your glycogen stores will only last 18 to 24 hours, no? So some textbooks say 18, some textbooks say 24, no? So 18 to 24 hours. That's why you will see after 24 hours wala na tayong glycogen. Kaya after 24 hours, so kunyari kumain ka 8 a.m. Monday, tas hindi ka pa din kumakain. 8 a.m. ng Tuesday, kailangan mo na ng bagong glucose source. And what pathway will provide glucose? Pag wala ng glycogen, it will now be gluconeogenesis. You will now need to create glucose from other sources. Okay? So, what are the 4 possible sources? Number 1, all substrates of glycolysis and the Krebs cycle except for, so, sinong hindi pwedeng maging glucose? Acetyl-CoA. Number 2, in the Cori cycle, what becomes glucose? Lactate. Number 3, lipids, triglycerides. Sa triglycerides, sino pwede maging glucose? Dalawa yon. Number 1, you can get it from the glycerol backbone. So the glycerol backbone can be converted to DHAP and DHAP can be converted to glucose. Sino pa yung pwede maging glucose sa lipids? Remember your odd-numbered carbons, your fatty acids with an odd number of carbons, they will produce propionyl-CoA. And propionyl-CoA can be converted to succinyl-CoA. So succinyl-CoA can become glucose. And then finally, number 4, sa proteins, what can become glucose among all proteins? Which types of amino acids? Your glucogenic amino acids. So the glucogenic amino acids, their carbon skeletons can be recycled to glucose. Diba? So among those 4, which one is the most important substrate for gluconeogenesis? It will be your proteins. And that is the reason why during severe malnutrition, or for example, in fasting, severe or in prolonged fasting, or in stressful situations like severe injuries or burns, what happens? You lose muscle mass because the proteins are being converted to glucose. Okay? The other graph you need to remember is this one on the right side. So here on the right side, this is also important. Okay? So you will see what happens. The first graph tells you how you use your fat. So your fatty acids, habang tumatagal yung fasting, ginagamit natin siya. We break down your fats. No? They undergo beta oxidation. Okay? So remember, what's the product of beta oxidation? You produce acetyl-CoA, FADH, and NADH. So remember another key point you need to remember. During the fed state, what provides acetyl-CoA? Which pathway? Glycolysis. But during the fasting state, the majority of fatty acetyl-CoA will come from beta oxidation. What is the other important role of beta oxidation? Beta oxidation provides the energy for gluconeogenesis. To be able to synthesize glucose, you need to burn fat. And then finally, the last curve, this is your beta hydroxybutyrate. As you will see, ano ba yung beta hydroxybutyrate? Ito yung ketone bodies. No? So your ketone bodies, as you go on a prolonged fast, pataas sila ng pataas. So once again, so the feed-fast cycle, you need to remember, okay, sa feed-fast cycle, you need to remember what each organ does, no? When you are well-fed or when you're fasting. So some terminologies, yung well-fed state, it's the absorptive state. Yung fasting state, post-absorptive. So don't get confused, okay? So fed state, absorptive state. Fasting, post-absorptive. So when you say absorptive, fed state, 2 to 4 hours after a meal, insulin is elevated, and because of this, there will be increasing glucose, amino acids, and triglycerides in the plasma or in the blood. So the pancreas, remember, review. So pag kumain ka ng carbohydrates, balikan nga natin yung glucose transporters. So pag kumain tayo ng carbohydrates, the glucose is absorbed in the small intestines. Remember? So your glucose is absorbed in the small intestines. What is the glucose transporter in the lumen of the small intestine? It will be SGLT. Okay? Sodium glucose luminal transporter, SGLT1. Although pwede rin siya sa GLUT5, no? How about in the basement membrane? So SGLT siya, secondary active transport yung glucose. And then pagdating sa basement membrane, it will be absorbed by GLUT2, no? Basement membrane, 2 words. It will be absorbed via facilitated diffusion, GLUT2. And then glucose will go to the liver and pancreas. How does glucose enter the pancreatic cell? What's the glucose transporter? Pancreas is also GLUT2, no? Pancreas is also GLUT2. And when glucose enters the pancreas will secrete insulin. Why do you need insulin? Because insulin will facilitate entry of glucose into which cells? Muscle and adipose tissue. And what's the glucose transporter in these tissues? GLUT4. Okay? So, during the absorptive state, you are in an anabolic period. No, you are in an anabolic period. So, look here. So, you will see here, this shows you the fed state, no, the absorptive state. So, sabi natin, pag kumain tayo, tataas yung glucose, Glucose will enter the pancreas and the liver. The liver will secrete insulin. Insulin will promote absorption of glucose in muscles and adipose tissue. No? So, now, you will see anong ginagawa ni liver. Busy siya. No? Kapag during the fed state, look what it does. It stores glucose as glycogen. It also synthesizes triglycerides, and the triglycerides are exported to the other tissues. Or review, lipid transport. Sabi natin, hindi kasalanan ni adipose tissue. During the fed state, si liver gagawa ng triglycerides, fatty acids and triglycerides. Si triglycerides, kailangan pumunta sa ibang tissues. Pag nakita niya yung blood, anong sasabihin niya? Ew. So, tatawag siya ng toxic. Sino yung magta-transport ng triglycerides from the liver to the adipose tissue and to the other tissues? Si VLDL. No? VLDL. In contrast, yung mga fats na na-absorb natin sa intestines, sino magta-transport sa kanila? Si chylomicron. No? Si chylomicron. Okay? So, now here, in the post-absorptive state naman, the fasting state, glucagon naman yung mataas. Hindi na tayo kumakain. No? You will now break down fats. You will now break down glycogen. You will convert proteins to glucose, gluconeogenesis. So you will see in the fasting state, glucagon yung mataas. Okay? What does the liver do? The liver will break down glycogen to glucose, and the glucose will be exported to other tissues. Si brain, okay, si liver gagawa din siya ng ketone bodies para mapunta kay brain. Okay? Muscle, magkakatabolize din siya ng proteins para maging amino acids and glucose. No? Mag-gluconeogenesis tayo. Si fats, i-breakdown natin yung triglycerides para maging glucose. So here, no? So in summary, look. So when you look at the different organs, so the preferred fuel during the fed state is glucose. So when you look at the brain, no, ang nangyayari sa kanya, kapag fed state, glucose yung gusto niya. Pag fasting, glucose pa rin. Pero ang maganda, meron siyang alternate fuel. Pag walang glucose, pwede siyang gumamit ng ketone bodies. Now recall, bakit hindi pwedeng mag-beta oxidation si brain? Because the fatty acids cannot cross the blood-brain barrier. Wala rin siyang significant triglyceride stores. The brain synthesizes fatty acids mainly for its phingolipids. No? Erythrocytes, your red blood cells. The thing about your mature red blood cells, they do not have mitochondria. And because they do not have mitochondria, wala tayong electron transport chain. No? So, anaerobic glycolysis lang tayo. So, it uses glucose exclusively as fuel. No? So, aside from anaerobic glycolysis, ano pa yung pathway na meron sa red blood cell? So, aside from anaerobic glycolysis, dapat meron din siyang pentose phosphate pathway, di ba? So, dapat meron din siyang pentose phosphate pathway. Kasi yung pentose phosphate pathway, yun yung nagpo-produce sa kanya ng NADPH. No? That will produce NADPH, protecting it from oxidative injury. Liver. So, ano naman ang meron kay liver? Remember si liver during the fed state. Ano nangyayari sa liver during fed state? So, si liver sa fed state, di ba pag fed state, para yung piyesta, no? Lahat kainan, no? So, sa bahay nyo may handaan. Lahat ng organs, kain ng glucose. Si liver, yan yung tita mo na habang lahat nagkakainan, maglalabas ng Tupperware. Okay? Siya yung habang lahat nagpapakasarap siya, magsustor siya for future use. So, that's why during the fed state, the liver will convert glucose to glycogen. It will synthesize fatty acids and convert them to triglycerides, and then the triglycerides are exported to other tissues using VLDL. Okay? It will also activate the pentose phosphate pathway. Bakit niya kailangan mag-pentose phosphate pathway? Mag-pentose phosphate pathway siya kasi kailangan natin yung NADPH, which is used for fatty acid and cholesterol synthesis. Okay? It will also synthesize proteins. Paano naman yung fasting state? What about when nag-go on na fasting state? Si liver, siya na yung nagpapaka-martyr. So, ano yung mga pathways na gagawin niya para makapag-provide ng energy for other tissues? It will break down glycogen. So, glycogenolysis to create glucose. It will convert other substrates to glucose, so gluconeogenesis. It will create ketone bodies for the brain and other tissues. Okay? It will undergo beta oxidation to burn fat, no? So remember that, no? So remember, no, habang lahat, no, siya yung nag-aalala, nako, wala na silang fuel. Remember, the liver cannot use ketone bodies kasi wala siyang thiophorase enzyme. The other thing you need to remember, no, ano nangyayari during the whenever you eat. Whenever you eat carbohydrates and proteins, sa kanya muna napupunta yung nutrients, no, sa portal circulation. So bago mapunta sa systemic circulation, kay liver muna. How about the kidney? What's the special role of the kidney during fasting? Remember? Gluconeogenesis. Liver and kidney. So the kidney can play can up to 40% of gluconeogenesis can happen in the kidney when you're fasting. No, up to 40%. Normally only around 10%. The other important thing is, ano pa yung role ng liver, ni kidney? Remember that glutamine. Alala niyo si glutamine? Anong role ng glutamine? Basurero din yan, di ba? Yung glutamate, pwede siyang mamulot ng ammonia, magiging glutamine. Glutamine can enter the kidneys. And in the kidneys, merong glutaminase enzyme, which removes the ammonia. This is important because when you go on fasting, no, during prolonged fasting, tumataas yung ketone bodies, di ba? Nagkakaroon tayo ng metabolic acidosis. The excretion of ammonium ion in the kidneys during the fasting state helps you i-balance, no, yung metabolic acidosis, no? So yung metabolic acidosis. Pagkatapos when you're fasting, nag-gluconeogenesis tayo, okay? Pag nag-gluconeogenesis tayo, yung mga amino acids, 'di ba? Yung carbon skeleton nila, maraming tinatanggalan na yung amino acids, tinatanggalan natin ng ammonia. Kasi yung carbon skeleton lang naman yung magiging glucose. So the ammonia must be converted to urea, which is excreted in the urine. So helps you dispose of nitrogenous waste. Finally, adipose tissue and muscle. Remember, GLUT4 yung transporters nila. They require insulin para makapasok si glucose. Okay? So your adipose tissue, ano nangyayari sa kanya during fed state? You will synthesize triglycerides. No? You will synthesize triglycerides. During fasting, what will break down triglycerides? So if you remember your triglycerides, sino yung gugupit sa triglycerides? Okay? So babalikan natin yung drawing. So for example, di ba, sabi natin, okay, yan. Okay, you see here, this is your triglyceride. So if that's your triglyceride, sino yung gugupit sa kanya? Okay, scissors, drawing tayo ng scissors. Sino yung gumugupit kay triglycerides during the fasting state? It will be hormone-sensitive lipase. No? Hormone-sensitive lipase. So, pag ginupit niya, ito, sino to? This is glycerol. What will happen to glycerol? Glycerol will be converted back to glucose, gluconeogenesis. What about the fatty acids? The fatty acids will undergo beta oxidation. No? The fatty acids will undergo beta oxidation. How about skeletal muscles? Kasi skeletal muscle, ito yung pinakaswerte, pinakaswapang din sa lahat, no? So, ano nangyayari? During the fed state, no, what's the preferred energy source? Actually, your muscle, malakas sila kumain ng fatty acids, no? So, main energy source ng mga yan, fatty acids, fats. Okay? At the same time, during the fed state, no, nagpo-protein synthesis tayo, no? Lalo na pag nag-workout. And then, nagsisynthesize siya ng glycogen. Remember, it stores glycogen for its own use. So, aside from the liver, muscle, maraming glycogen. When you go on fasting, muscle yung pinakamaraming energy source. Can it use glycogen? Yes. Can it use fatty acids? Yes. Can it use ketone bodies? Yes. Diba? Pero yung proteins nga, gine-degrade natin. No? Bine-breakdown natin to amino acids, and the amino acids are converted to glucose. That's why, no, during severe illness, like or trauma or burns, anong kailangan natin gawin? We need to make sure that the carbohydrates are replenished. Otherwise, if you don't give your patient enough carbohydrates, your patient will break down proteins. Magwa-muscle wasting yan kasi kino-convert mo siya to glucose. Okay? Later, we will discuss muscle during exercise. And remember, lactate. Lactate can be converted back to glucose in the Cori cycle. For the discussion on nutrition, we will be focusing on diseases, metabolic diseases, specifically diabetes, effect of alcohol, or what you do during exercise. So, we will try to see how the pathways relate or are changed when you have these physiologic or pathologic states. And then we will be discussing vitamins and minerals. So this time, the focus in biochemistry for vitamins and minerals will be to try to identify, you will need to identify where specifically in the biochemical pathways these vitamins and minerals play a role. Okay, so ang focus natin dito hindi yung structure, but yung exact pathways na kung saan natin sila kailangan. You have to remember, vitamins and minerals, most of the time, they play a role. Their role will be to serve as coenzymes or cofactors. That's why, kapag walang vitamins or minerals, hindi magpa-function yung enzyme. So first, metabolic syndrome. So when you have metabolic syndrome, this is abdominal obesity associated with glucose intolerance, insulin resistance, hyperinsulinemia and dyslipidemia, and hypertension. So review, among the dyslipidemias, which type is most associated with metabolic syndrome? So ito yung type 4, no? Huwag niyong kakalimutan yan, no? Pag metabolic syndrome, no? Diabetes, no? Pag binigyan kayo ng case, type 4 yan. It is very important for you to understand the metabolic effects of diabetes mellitus. Always may question on diabetes mellitus. So let's try to explain, no? So first, hyperglycemia. Why do you get hyperglycemia with diabetes mellitus? So ito lang yung tatandaan niyo. Remember, what's the hormonal profile when you have diabetes mellitus? So ang nangyayari pag meron kang DM, very low insulin, very high glucagon. Remember that, ha? Lalo na pag type 1 diabetes, walang insulin. So isipin nyo lang, walang insulin, maraming glucagon. Para siyang extreme fasting. So why do you get hyperglycemia? So dahil walang insulin, pag kumain tayo, glucose will not be able to enter which organs? Muscle and adipose tissue. Because this require, anong glucose transporter nila? GLUT4. So dahil walang insulin, hindi sila makapasok. Glucose remains in the blood. At the same time, kapag mababa ang insulin, mataas ang glucagon. Anong pathways ba yung ina-activate ni glucagon? Gluconeogenesis and glycogenolysis. So therefore, tumataas yung glucose. Next, you have hypertriacylglycerolemia, elevated triglycerides, because of dahil maraming glucagon pero walang insulin, yung VLDL at chylomicron mataas, Tumataas yung VLDL and chylomicron, hindi natin ma-utilize yung mga fatty acids. Why do you get ketoacidosis, So now, let's try to see. So, bakit yung ketoacidosis? This is a prominent feature of type 1 diabetes, So, ano nangyari? Remember, mataas ang glucagon. Pag mataas ang glucagon, you will break down fat. Diba? So, triglycerides are broken down into fatty acids. Fatty acids undergo beta oxidation. And then, the acetyl-CoA will be converted to ketone bodies. Bakit kapag type 2, blunted yung ketosis, Bakit moderate? Because sa type 2 diabetes, remember, meron naman silang insulin. They still have insulin, may insulin resistance lang. The presence of insulin blunts ketosis. So, kumbaga, kaya hindi tayo nagkiketosis masyado kasi meron ka pa rin namang insulin. Okay? So, again, remember this. So, bakit tayo may hyperglycemia? Increased gluconeogenesis, increased glycogenolysis, and then decreased uptake of glucose. Bakit may ketoacidosis? Because of excessive glucagon levels. So, huwag niyong kakalimutan, So, ano usually yung scenario na ibibigay nila dito? So, usually, they will give a case of a patient in diabetic ketoacidosis. So, bibigay sila ng patient DKA. And then, it will ask you, which of the following pathways will be active? So, isipin mo, nasasagot doon, glycogenolysis, gluconeogenesis. lipolysis. Okay, so parang ganun yung mga scenario na ibibigay. Now, with regard to management of diabetic ketoacidosis, you need to review this, but I will leave it to your internal medicine lecturers. No? Sila na kasi nakakaalam ng latest guidelines on how to manage DKA. No? But for you, you need to understand the biochemical process behind it. Ketogenic diet, no? May mga 2 or 3 years ago, favorite nito to. Lagi itong lumalabas sa board exam nung time na uso yung ketogenic diet. How does a ketogenic diet promote weight loss? No? How does a ketogenic diet promote weight loss? Now, you need to know that a ketogenic diet is not just for weight loss. No? Ketogenic diets have been used for seizure control. So, patients with epilepsy, no, ang ginagawa sa kanila, no, they are put on a ketogenic diet and this helps them achieve some seizure control. Pero paano siya nakakapayat? No? When you say ketogenic diet, you reduce carbohydrates. So, dahil tatandaan nyo, pag ketogenic diet, you reduce carbohydrates to less than 50 grams per day. So, essentially, 200 calories lang ang kukunin mo from carbohydrates. And a relative increase in the proportion of protein and fat. So, paano siya bakit ka papayat nun? Kasi when you go on a ketogenic diet, kumakain ka pero walang glucose. Diba? So, kakain ka pero walang glucose. So, kahit kumain ka, anong sasabihin ng body mo? Ay, wala akong glucose. Hindi ako kumain ng glucose. What will be your body's response? Sige nga. So, pag kumakain ka pero walang glucose, anong iisipin ng body mo? Walang glucose. Kailangan kong gumawa ng glucose, di ba? So, gagawa ka ng glucose. So, saan ka kukuha ng glucose? Anong gagawin mo? So, dahil wala kang glucose, you will break down, okay? You will break down fats. No? Bakit ka mag-break down ng fats? You need to break down fats because you need to undergo gluconeogenesis. So, dahil hindi ka kumain ng glucose, mag-gluconeogenesis ka. And remember, gluconeogenesis requires beta oxidation for energy. Okay? Kaya tayo dun pumapayat. No? Kaya tayo pumapayat. Kasi dahil walang, tapos the other thing is, dahil walang carbohydrates, hindi magi-insulin spikes. So when you look here, look, in the normal diet, this is our glucose level, you will see, okay, yung insulin natin mataas. When you go on a ketogenic diet, yung fluctuation ng insulin, narrow lang. No? Narrow yung fluctuation ng insulin. And remember, insulin is an anabolic hormone. So, when you go on a ketogenic diet, no, what happens is you reduce fatty acid synthesis and break down fats because you need to undergo gluconeogenesis. At the same time, when you eat more proteins are able to result in higher satiety. So, mas madaling makabusog pag proteins. No? Mas madaling makabusog yung proteins. At the same time, they say ketone bodies have an appetite suppressant effect. What about muscle during exercise? You need to recognize the difference between a sprinter and a marathoner. Ito din, favorite din nila itong tinatanong. Ano pinagkaiba ng sprinter sa marathoner? Yung sprinter, no, yung 100-meter sprint, anong energy source ng muscle doon? It will be creatine phosphate, no, yung phosphocreatine during the first 4 to 5 seconds, and then anaerobic glycolysis. So, anaerobic glycolysis tayo kukuha ng energy doon. Pero pag marathon, aerobic glycolysis, aerobic metabolism ang kailangan. So, you undergo aerobic glycolysis, you undergo beta oxidation, and then you gradually burn your glycogen. So, between the two, look, pag sprinter, type 2 glycolytic fibers ang ginagamit natin. Pag marathoner, type 1 or oxidative fibers. The energy source for a sprinter is anaerobic glycolysis. Energy source for marathon runner will be fatty acids and glucose. When you sprint, you use up rapidly your glycogen stores. When you run a marathon, you slowly deplete glycogen. Do not forget. Alcoholism. So, alcoholism, again, favorite ulit nila to. No? May time, parang 5 questions galing lang sa alcoholism. There is only one thing you need to remember about alcohol. Ito lang ha, kung meron lang kayong isang bagay na tatandaan about alcohol metabolism, and then you will remember everything. When you metabolize alcohol, you have excessive levels of NADH. Why is that bad? No? So again, no, wag kakalimutan. Alcohol, NADH. No? Alcohol, NADH. Pag uminom ka ng alcohol, NADH tumataas. So let's review the metabolism of alcohol. I'm sure you also studied this in pharmacology. You convert ethanol to acetaldehyde and then acetaldehyde to acetate. So two enzymes yan. So when you metabolize alcohol, you convert ethanol to acetaldehyde and acetaldehyde to acetate. The enzymes are alcohol dehydrogenase and aldehyde dehydrogenase. O, may tanong ako, bakit may ibang tao madaling mamula pag uminom ng alak? No? Many Asian, yung Asian flush, no? After just one bottle, one shot, one glass of alcohol, namumula na agad. But yung ibang tao, ang dali ma-hangover, no? Ang daling malasing. Yung feeling of hangover, being hangover, that's because of the accumulation of acetate. This one. Sorry, not acetate, but acetaldehyde. It's because of the accumulation of acetaldehyde. So people, yung mga madaling malasing, ano yung enzyme deficiency nila? It's because they have deficient activity of the second enzyme, acetaldehyde dehydrogenase. Okay? So yung mga tao madaling malasing, remember that? Kulang sila sa aldehyde dehydrogenase. That's why acetaldehyde accumulates, causing the symptoms of hangover. Now, yung disulfiram, narinig nyo na yung disulfiram effect. What do you mean when we say disulfiram effect? When you give disulfiram, it inhibits aldehyde dehydrogenase. So therefore, ano mangyayari? Kunyari may alcoholic, binigyan mo siya ng disulfiram. Ano mangyayari? Pag uminom siya kahit konti, dahil na-block natin si aldehyde dehydrogenase, mag-accumulate si acetaldehyde. Kaya kahit konti lang inumin niya, nahahangover na siya, mahilo na siya, mamula na siya, sakit ng ulo niya, ayaw na niyang uminom. Okay? So now, remember the drugs that can cause disulfiram effect? So, example, metronidazole, no? So if you're on metronidazole, wag ka siguro mag-inom, no? Kasi magda-disulfiram effect yun, magmamatinding hangover ka. Now, going back, what is the effect of alcohol? When you drink a lot of alcohol, tataas yung NADH. Okay? Tataas yung NADH. And what are the bad effects of NADH? Yun yung aaralin natin, no? Pero balikan muna natin to. Yung ibang mga tao, no, when they over time, di ba, sabi na, dati dali mong mamula, ngayon ba't hindi na? No? Dati dali-dali mong malasing, ngayon hindi na. It's because you have an alternate pathway of alcohol metabolism aside from what I showed you, no? So, in chronic alcoholics, you activate the microsomal ethanol oxidation system in the smooth endoplasmic reticulum. Okay? So, ito yung alternate pathway. Now, what are the effects of alcoholism? Tatlo lang yung tatandaan nyo. Hypoglycemia, lactic acidosis, and ketoacidosis. So, tatlo, no? Hypoglycemia, lactic acidosis, and ketoacidosis. So, bakit, no? So, bakit nagkakaroon ng mga ganyan in alcoholics? Okay? So, sabi ko nga, babalikan natin yung, okay, babalikan natin si NADH. So, look here. So, you will see here, pag tumaas yung NADH, ano mangyayari? Si pyruvate magiging lactate. Diba? Pyruvate to lactate requires NADH. That's why you get lactic acidosis. What else? Si NADH will drive oxaloacetate pabalik sa malate. So remember your Krebs cycle? Si oxaloacetate babalik yan sa malate. Kasi mataas yung NADH. So babalik yung, pabalik, magre-reverse siya. So ano mangyari? Dahil si oxaloacetate babalik kay malate, ano bang role dapat ni oxaloacetate? Siya yung sasalubong kay acetyl-CoA. So si acetyl-CoA, instead na pumunta sa Krebs cycle, saan na siya pupunta? Kung hindi siya sasalubungin ng oxaloacetate, saan pwede pumunta si acetyl-CoA? Acetyl-CoA will enter ketone body synthesis. So acetyl-CoA will go to ketogenesis. So kaya merong lactic acidosis, meron pang ketosis. Paano ka nag-hypoglycemia? Bakit yung mga lasing, di ba? Di ba pag may mga lasing na dumating sa ER, you have to get CBG. Bakit sila prone to hypoglycemia? So dahil mawala ng pyruvate, dahil wala na rin oxaloacetate, remember, what prevents hypoglycemia during fasting? Gluconeogenesis. And the first step of gluconeogenesis is pyruvate to oxaloacetate. So dahil wala na tayong pyruvate, wala na pang oxaloacetate, walang gluconeogenesis, hypoglycemic. Okay, so remember this. How about the other effects long term? Number 1, hyperuricemia. Lactate will compete with urate for excretion by the kidney. This is the reason why those with gout, pwede sila mag-acute gouty arthritis from alcoholism. Number 2, thiamine deficiency. So thiamine deficiency, remember, thiamine deficiency, alcohol inhibits thiamine absorption. So alcohol inhibits thiamine absorption, and what do you get? Yung Wernicke-Korsakoff syndrome. So babalikan natin ito mamaya. Bakit nagfa-fatty liver? So bakit nagfa-fatty liver? So remember, maraming NADH. Pag maraming NADH, babaliktad yung beta oxidation. You will not be able to oxidize fats. Instead, it will promote fatty acid synthesis. No? It will promote fatty acid synthesis. What else? Hey, yung VLDL secretion nababawasan, no? So, anong nangyayari, no? So, kapag chronic alcoholic ka, no? Increase yung synthesis ng triacylglycerols, no? Increase yung synthesis ng triacylglycerols. Bakit yung mga batang merong kwashiorkor, fatty liver sila? No? Bakit yung mga bata, sabi mo, ang taba-taba naman eh, no? Fatty liver, no? Akala ko ba malnourished? So, bakit yung mga batang may kwashiorkor nagpa-fatty liver? Remember, to be able to export fatty acids, you need VLDL. You need apoproteins. So, dahil walang protein, may protein energy malnutrition, hindi nila ma-export yung fats. Kaya nagpa-fatty liver sila. Hepatitis, of course, no, results from acetaldehyde and free radical generation. And then long-term, you get cirrhosis, which is a precursor for hepatocellular carcinoma. The problem with cirrhosis is you get portal hypertension. No? So yung portal hypertension, tataas yung portal venous pressure, you develop these collateral circulations, tuloy-tuloy na doon. No? So magkakaroon ka na ng varices, magkakaroon sila ng hemorrhoids, they will get hepatic encephalopathy. So balikan nyo yun, ha? So balikan yung hepatic encephalopathy, why you get hyperammonemia when you're an alcoholic. Finally, fetal alcohol syndrome. This arises from maternal alcohol consumption during pregnancy. So ito yung typical features, no? Smooth yung feel-through, upper lip. Okay? So they can have growth retardation, they have cognitive deficits, no? Pero ito, very characteristic, no? Very characteristic, smooth feel-through, tapos yun, short palpebral fissures. Okay? Fetal alcohol syndrome. So don't drink alcohol if you're pregnant. We will now go to your vitamins. So recall that you have two classifications. Your vitamins are classified into two in biochemistry. You have your water-soluble and your fat-soluble vitamins. So between the two, no? So yung fat-soluble, yung A, D, E, and K. So quick questions. Between the two, which one is more toxic? The correct answer will be your fat-soluble vitamins because they tend to accumulate in the body. The water-soluble vitamins, well, if you overdose on them, iihilang natin yan, no? Kasi nga water-soluble sila, no? So, but, no, dun sa water-soluble vitamins, even though they're less toxic, they're less likely to accumulate. Which one among the water-soluble vitamins can be toxic? The correct answer is vitamin B6, no? Pyridoxal phosphate. So when you overdose on B vitamins, pyridoxal phosphate is known to cause toxicity. How about sa fat-soluble vitamins? Sa fat-soluble vitamins, alam natin sila yung mas toxic. Sino yung least toxic sa fat-soluble? It will be vitamin E or tocopherol. No? So, sa water-soluble and fat-soluble vitamins, yung water-soluble vitamins, as I've said, they're the ones more likely to participate in chemical reactions and they usually serve as cofactors or coenzymes. Yung vitamins A, D, E, and K, mas important yung role nila, no, sa yung other roles nila rather than being cofactors or coenzymes. So, ano lang tatandaan natin, no? Remember the active form, the storage form. So vitamin A, different forms. You have retinol, retinal, retinoic acid, beta-carotene. So beta-carotene, no, is the one that's parang pinaka-useless yan, no? So, pinaka-mababa yung value sa atin, no? So, kunyari, kukuha ka ng vitamin A, no? 1/6 lang siya ng power ni retinol. No? 1/6 lang yung power ni retinol. The other thing about biochemistry and vitamins, they sometimes ask, no, what are the energy sources? Saan mo sila makukuha? What do you need to eat? Or for example, they will give a question of, obviously, vitamin A deficiency. And then the question is, what will you recommend in the diet? Ganun, no? Ganun sila magtanong. So please, do not disregard. The reason why we put here in the slides, no, yung sources, is because they ask these questions. So always remember as well the role of vitamin A in the visual pathway, no? So you will see here. So 11-cis retinal, no? 11-cis retinal, once it hit may visible light, it is transferred to all trans-retinal. No, it's transformed to all trans-retinal. So your vitamin A, the active form is retinol. No? So ito yung beta-carotene, no? Walang kwenta, yan yung 1/6 lang ng power niyan, yung retinol. No? So retinoic acid, remember the role of retinoic acid in growth and differentiation. No? So retinoic acid is important for cells to become who they are meant to be. Most common, no? So laging tinatanong to, no? Siguro mga twice or thrice na itong tinanong different years of the board. What is the first sign of vitamin A deficiency? What is the first sign of vitamin A deficiency? It's not night blindness, but loss of sensitivity to green light. So in Harper, no, nakalagay yun. The first sign of vitamin A deficiency is loss of sensitivity to green light. And then tsaka lang yung nyctalopia or night blindness. Tsaka lang yung nyctalopia. And then xerophthalmia, which is dry eye. Vitamin A is the leading cause of preventable blindness around the world. Leading cause of preventable blindness around the world. It is also toxic, no? So it is toxic vitamin, hypervitaminosis A. If you have excessive intake of vitamin A, meron tayong tinatawag na pseudotumor cerebri. When you say pseudotumor cerebri, these patients will present with raised intracranial pressure, headache, papilledema, pero wala namang tumor. Okay, wala namang tumor. The other thing they always like to say about vitamin A is it's teratogenic. So excessive doses of vitamin A should be avoided during pregnancy. Vitamin D is not really a vitamin. It is a hormone. So pag tinanong kayo which among the vitamins is really a hormone, the correct answer is vitamin D. Vitamin D, no, it's vitamin D2, yung vitamin D2 and vitamin D3. Yung vitamin D3, yun yung na-form sa skin, no? Cholecalciferol. It's the one formed in the skin. Vitamin D2, this is the one that's commonly added to milk and butter. So normally yung milk, wala yung vitamin D. Fortified lang yung milk natin, kaya siya nagiging rich in vitamin D. The active form is 1,25-dihydroxy vitamin D. So it's a hormone. It is important for calcium hemostasis. So ito yung tatandaan nyo, no? So calcitriol, it is important for maintaining the calcium pool. Kailangan natin yung calcitriol, no, to promote bone formation. So you see here, no? So it helps you absorb, no? Kailangan natin yung calcitriol para tumaas yung calcium para meron tayong pang-deposit into bone. Okay? It inhibits excretion of calcium in the urine. Now, remember this. This is the active form of vitamin D. 1,25-dihydroxy vitamin D. So may hydroxyl group sa carbon number 1 at sa number 25. So this hydroxylation happens in two organs. The first one, the 25-hydroxylation, ito, ina-add yung hydroxyl group na yan, where? In the liver. Ito naman yung 1-hydroxylation that happens in the kidney. This is the reason why patients who have chronic kidney disease, they will have vitamin D deficiency because they are unable to activate vitamin D. That's why all patients with chronic kidney disease, yung mga nagdadialysis, they are prone to osteoporosis. And you need to give them vitamin D supplement. Vitamin D deficiency when you're young, in children, this manifests as rickets, wherein the bone is under-mineralized. In elderly, in adults, it's osteomalacia, where you have demineralization of bone. Toxicity, if you have excessive vitamin D intake, it can result to hypercalcemia. No? So calcinosis, calcium deposition in soft tissue. Okay, so you have calcinosis or calcium deposition in soft tissue. How about vitamin E? As I've said, vitamin E is the least toxic. No? It's the least toxic among the fat-soluble vitamins. It's poorly defined, no, yung role, no. So hindi nila sure para saan ba talaga tong vitamin E na to. Okay, kaya siya minamarket as antioxidant, no, pampabata, pampaganda, no. Kasi nga poorly defined yung role niya, but it is an antioxidant. If they ask you which among the vitamins is an antioxidant, pinakatamang sagot dyan, vitamin E. No, it's vitamin E. So vitamin E deficiency is extremely rare, no, but it can cause hemolytic anemia. Tatanong na din ito. One time, tinanong na din ito. Which vitamin deficiency causes hemolytic anemia? It is vitamin E. And as I've said, it's the least toxic of the fat-soluble vitamins. Finally, sa fat-soluble vitamins, you have vitamin K. So, yung vitamin K, normally, we can produce it in the gut. No? So, we can menaquinone. It is synthesized by intestinal bacteria. However, yung mga newborns, they are prone to vitamin K deficiency. Why? Number 1, wala pang bacteria yung gut nila. Number 2, breast milk is a poor source of vitamin K. That's why all newborns, we need to give them vitamin K injection, yung menadione. No? Vitamin K injection, menadione. Remember that. Now, vitamin K, anong role niya? It is a coenzyme for gamma carboxylation of glutamate in clotting factors. Meaning to say, it promotes clotting. It promotes clotting. That's why infants who are deficient in vitamin K, they can get hemorrhagic disease of the newborn. No? So kawawa itong mga to. No? They get referred to us, neurosurgery. Why? They present with seizures, and when you do their ultrasound, they have massive subdural hemorrhages. All of this could have been prevented via a single shot of vitamin K. But you need to remember, hindi lang clotting factors, 9, 10, 7, 2, yung dependent sa vitamin K. But also, anticoagulating factors, yung protein C and protein S. That's why, no, if you block the effect of vitamin K, no, so for example, if you give warfarin, no, pwede actually procoagulant siya during the first few days. So, kasi nabablock mo din yung protein C and protein S. So, kaya nga meron tinatawag na warfarin-induced thrombosis. Kaya dapat, pag magsa-start ka ng warfarin, dapat i-overlap mo siya with heparin because it can have a procoagulant effect. Again, deficiency presents as hemorrhagic disease in the newborns. It is rare in adults, no? It is rare in adults because meron tayong gut bacteria that produce vitamin K. Okay? So as I've said earlier, in the water-soluble vitamins, you need to try to recall saang pathway sila kailangan, no? So because these participate as enzyme cofactors. So all the B vitamins, no, vitamin C, folate, biotin, you need to try to recall. Tignan natin kung maalala niyo yung mga pathways. First, thiamine. Thiamine is vitamin B1, no? So remember food sources. So it is a coenzyme for pyruvate dehydrogenase. So, ano ang pyruvate dehydrogenase? Ang pinaka maarte, no? It converts pyruvate to acetyl-CoA. So, vitamin B1 plus 4 other cofactors. So, what will happen if you do not have pyruvate dehydrogenase? If you do not have pyruvate dehydrogenase, si pyruvate hindi magiging acetyl-CoA. Cannot go down. Where will it go? It will go up to lactate. So, may lactic acidosis, di ba? Sinong pinsan ni pyruvate dehydrogenase? Si alpha-ketoglutarate dehydrogenase. That's why vitamin B1 deficiency also impairs the action of alpha-ketoglutarate dehydrogenase. Branch-chain amino acid dehydrogenase. So, saan nyo narinig yan? Sa maple syrup urine disease. No? So, yung valine, isoleucine, and leucine. Merong variant ng MSUD na responsive to thiamine supplementation. Number 4, transketolases. Saan nyo narinig si transketolases? pentose phosphate pathway. First phase or second phase? Second phase. What's the characteristic of the second phase? It's non-oxidative, reversible. Para lang tayo naglalaro ng Lego. And what's a special product? What's the important product in the second phase of the pentose phosphate pathway? Ribose phosphate, which is the precursor for deoxyribose, no? Deoxyribose. So ribose and deoxyribose are the sugars in your RNA and DNA. So if you have deficiency in vitamin B1, you get beriberi. So hindi na uso to, no? So dati maraming beriberi kasi inugasan yung bigas, no? So may dry beriberi, wet beriberi. You just need to study this in pediatrics. Now, hindi na siya uso kasi you already fortify our grains with thiamine. Ano yung mas pwede nyong ma-encounter? Yung Wernicke-Korsakoff syndrome. So if you see here, this is a slide showing you the mammillary bodies, coronal section of the brain. This is our brain coronal cut. And you see this hemorrhage in the mammillary bodies. Ito yung characteristic feature in Wernicke-Korsakoff syndrome. Magkaiba actually yung Wernicke encephalopathy sa Korsakoff syndrome. When you say Wernicke encephalopathy, ito yung ataxia, so or unsteady gait, confusion, and ophthalmoliplegia. So, nagduduling-duling sila, no? In contrast, when you say Korsakoff syndrome, ito yung mga memory problems, amnesia, hallucinations. Most very characteristic is confabulation. What do you mean by confabulation? Tinanong mo yung pasyente, ano bang ginawa mo kahapon? Hindi niya maalala. At dahil hindi niya maalala, anong gagawin niya? Mag-iimbento siya ng kwento. So that's confabulation. So remember, that's vitamin B1 deficiency. Very rare ang toxicity sa vitamin B1. Vitamin B2, riboflavin. You have to remember, riboflavin, electron carrier, FADH. No? Sa FADH sa kanya galing. So, remember again, no, kung saan siya cofactors. Cofactor din siya ni alpha-keto glutarate dehydrogenase tsaka ni pyruvate dehydrogenase. Okay? If you have deficiency in vitamin B2, then you get seborrheic dermatitis, cheilosis, no, angular stomatitis, no, lagi yan. So yan yung pinakalagi na babanggit, no. So susugat yung lips nila, yung angles ng lips. Inflammation of the tongue. Toxicity is rare, no. So halos wala. So tandaan nyo lang, B2, riboflavin, FADH. Pag baka tanongin kasi tinatanong yan, no? Which B vitamin, no, is the source of FAD? Niacin is vitamin B3, nicotinamide adenine dinucleotide, and nicotinamide adenine dinucleotide phosphate, NAD and NADP. So you have to remember, niacin is synthesized from tryptophan. Okay, so niacin is derived from tryptophan. But to get niacin from tryptophan, you need another vitamin. What's that vitamin? Vitamin B6. So, kailangan mo ng B6 para makagawa ng B3. Okay, kailangan mo ng B6 para makagawa ng B3. Okay, so so function ng NAD, ng niacin. So, just like riboflavin, it is important for redox reactions. Okay? It's important for redox reactions. It is important for beta, saan siya ginagamit? Ginagamit din siya for lipolysis, no? Ginagamit din siya for it blocks lipolysis. Kaya ginagamit siya as a drug, di ba? Niacin is used for hyperlipidemia. No? So if you go to pharmacology, niacin can be used for dyslipidemia because it inhibits lipolysis. So deficiency of niacin leads to pellagra, diarrhea, dermatitis, dementia. What's the fourth D? Death. So, pag binigyan kayo ng case, no, pag may diarrhea tsaka dermatitis, usually yun yung common presentation, isip kayo pellagra. Paano nagkakaroon ng niacin deficiency? You can get niacin deficiency either kulang sa niacin or excessive yung metabolism. So, for example, pag corn-based diet. So, sa Africa, no? So, for example, when I was in Uganda, hindi sila usang bigas. Corn yung kinakain nila. Pero yung corn nila, maize yung tawag, no? Walang sustansya, matabang, no? Walang niacin. So, corn-based diet will lead to niacin deficiency. Pwede sila magpellagra. Sa heart nap disease naman, you have problem with tryptophan absorption. If you can't absorb tryptophan, walang niacin. Carcinoid syndrome sa surgery. Anong naalala niyo sa carcinoid syndrome? In carcinoid syndrome, tryptophan is metabolized and converted to serotonin. So remember, serotonin is also produced from tryptophan. So dahil lahat sila nagiging serotonin, wala na nagiging niacin. And then isoniazid inactivates pyridoxine. Pag walang pyridoxine, walang niacin. So flushing, remember flushing? So niacin, yung mga tinitreat ng dyslipidemia, namumula sila. Vitamin B5 is pantothenic acid. So tatandaan nyo lang sa vitamin B5. Vitamin B5, pantothenic acid, fat metabolism. Saan natin narinig si vitamin B5? Number 1, coenzyme A. CoA, di ba? When you activate fatty acids, you attach CoA. How many ATPs are needed? 2. So, what else? It is also part of the fatty acid synthase. So, kung babalikan nyo yung fatty acid synthase, yung code red, may pantothenic acid yun. Deficiency, again, rare. Pero laging ito yung buzzword sa kanya, burning foot syndrome, nutritional melalgia. Pag narinig yung phrase nutritional melalgia, vitamin B5 yan. Vitamin B6 is pyridoxine. Pag hindi nyo alam magsagot, pyridoxine ang best chances. Tandaan nyo yan ha. Pag hindi nyo alam magsagot, vitamin B6. Best chances of winning. So, pyridoxine, pyridoxal, pyridoxamine. So, ang tatandaan nyo sa pyridoxine, basta amino acid reactions. So, pag ang nasa question, amino acid reaction, most probably, pyridoxine yung sagot. Example, transamination. Ano yung transamination? Recall. Let's recall. Transamination. If you transaminate pyruvate, what will you get? So, pyruvate, dagdagan mo ng ammonia, magiging alanine. If you transaminate oxaloacetate, it becomes aspartate. If you transaminate alpha-ketoglutarate, what do you get? Glutamate. So those transamination reactions require pyridoxal phosphate. Number 2, decarboxylation. If you decarboxylate histidine, so histidine decarboxylase, anong product? Histamine. If you decarboxylate glutamate, anong product? GABA. So, lahat yan kailangan ng pyridoxine. ALA synthase. Saan yun narinig si ALA synthase? It's the first step of heme synthesis, glycine plus succinyl-CoA, forming delta-aminolevulinic acid that requires pyridoxine. Cystathionine synthase. Sa homocystinuria, methionine to homocysteine, homocysteine to cystathionine, cystathionine to cysteine. Sometimes, di ba, sa homocystinuria, you give vitamin B6. Synthesis of niacin from tryptophan, nabanggit ko na kanina. So, 1, 2, 3, 4, 5, lahat yan, amino acid reactions. Lahat yan, kailangan ng B6 or pyridoxal phosphate. Ang naiba lang si number 6, glycogen phosphorylase. Kagat. So, it's glycogenolysis, but it also requires vitamin B6. Deficiency is rare. But sa atin, sa Pilipinas, pwede siyang mangyari because isoniazid toxicity results in vitamin B6 deficiency. Pinaka-toxic sa water-soluble vitamins. You can get sensory neuropathy from pyridoxine overdose. Vitamin B9 is folic acid, and the active form is tetrahydrofolate. Take note that vitamin B9 is found in green leafy vegetables. It's the most common vitamin deficiency in the US, especially in pregnant women and alcoholics. So now, anong role ni folate? Folate is important because it transfers one carbon fragment. So it will transfer a one carbon fragment, for example, from serine, glycine, and histidine, and transfer them to synthesis of amino acids, purines, and thiamine. So anong kailangan tandaan? If you have folate deficiency, this manifests as megaloblastic anemia. The problem is, may isa pang megaloblastic anemia, vitamin B12. So, tatandaan nyo, folate and B12 deficiency, they can both manifest as megaloblastic anemia. Anong difference? Si B12 merong neurologic deficits, si folate wala. So, if you have maternal deficiency of folate, what's the problem? Your infant will be prone to this. On the left, this is spina bifida. So, you will see here, this is the spinal cord that's exposed. So, this patient will have lower extremity weakness, sensory deficits, and bowel bladder problems. Or, pwede namang anencephaly, yung anterior neuropore hindi magsasara. This is not compatible with life. So, possible causes. So, these are the causes. Poor intestinal absorption, poor intake, alcoholism, or folate antagonist. So, for example, no, methotrexate sila, no, or other medications. Now, what you need to remember is this. Yung folate, no, kino-convert siya to dihydrofolate using dihydrofolate reductase, and then further converted to tetrahydrofolate. Yung tetrahydrofolate yung kailangan natin, no? Yung tetrahydrofolate yung kailangan natin kasi yun yung nagtatransfer, no, ng carbon groups. So these carbon groups will now be transferred to form purines, thymine, serine, okay? And then homocysteine from B12, no, to form methionine. So you will see here, no? So look, si folate, kumukuha siya ng carbon, no, from serine or glycine. No, kukuha siya ng carbon, nagiging methylene tetrahydrofolate. Tapos, yung carbon na yun, ililipat naman niya. No? Idodonate naman niya para makaform ng methionine, okay? Or makagawa ng purines, as you see here. Okay? So, ngayon, ano yung tinatawag natin na folate trap? You see this, N5-methyl tetrahydrofolate. So, yung folate trap, you will see this N5-methyl tetrahydrofolate. Useless yan. No? Useless yan, yung N5-methyl tetrahydrofolate. Para magamit natin siya, yung methyl tetrahydrofolate, kailangan i-convert natin ulit to tetrahydrofolate. Okay? Pero para magawa yung kailangan natin ng B12. So, kung wala kang B12, ano nangyayari? If you have B12 deficiency, natatrap si folate as N5-methyl tetrahydrofolate. So, nagkaka-folate deficiency ka din. No? So, B12 deficiency can mask folate deficiency. Okay? So, tatandaan nyo yun, ha? So, tatandaan nyo, kapag walang B12, natatrap, kahit na enough naman yung folate mo, B12 deficiency can aggravate folate, no, deficiency. Pwede siyang, akala mo folate deficiency, yung pala hindi folate yung kulang, B12. Okay. So, vitamin B12 is cobalamin. So, cobalamin, the active form is methylcobalamin, deoxyadenosylcobalamin. Ang tatandaan nyo sa B12, yung enzymes niya, parehas na letter M. No? Parehas na letter M. Methionine synthase and methylmalonyl-CoA mutase. Paano mo ito pala, lagi lang yung tinatanong, no? Tandaan nyo, di ba, yung folate, galing sa green leafy vegetables. Yung B12, galing yan sa meat products. It's found in meat products. Kaya sino yung prone sa B12 deficiency? Yung mga pure vegetarians, no? Yung mga absolute vegetarians, sila yung nagkaka-B12 deficiency. Saan yung methionine synthase? Methionine synthase, no? Tandaan nyo yan, dun sa homocystinuria. Okay? Homocysteine can be converted back to methionine using B12. How about methylmalonyl-CoA mutase? Saan nyo narinig yun? Dun sa metabolism of odd-numbered fatty acids with odd number of carbons. Okay? So, propionyl-CoA to methylmalonyl-CoA, methylmalonyl-CoA to succinyl-CoA. Yung second step. Okay? Yung second step, methylmalonyl-CoA to succinyl-CoA requires vitamin B12. If you do not have vitamin B12, as I've said, you get megaloblastic anemia. So, you see here, hypersegmented neutrophils, very large red blood cells. How do we distinguish from folate deficiency? Yung B12 may sensory deficits. Ano yung very characteristic na sensory deficits? You get what is known as subacute combined degeneration. So, subacute combined degeneration because they have motor deficit, motor weakness. At the same time, they will have impairment in vibration and position sense kasi yung dorsal columns yung affected. Vitamin C is ascorbic acid. So, anong role ni ascorbic acid? It's an antioxidant. At the same time, it is a cofactor for copper and iron-containing hydrolases. So, sa collagen, naalala nyo anong role ni vitamin C? It is important for the hydroxylation of collagen. Hydroxyproline, hydroxylysine. Kaya kung walang vitamin C, you get scurvy. Mahina yung collagen molecule natin. Dopamine hydroxylase, saan yung narinig yun? Dopamine to norepinephrine, no? Dopamine to norepinephrine. Sa true love does not exist. Vitamin C also increases absorption of inorganic iron, which is why if you have iron deficiency, if you want your patient to increase absorption of iron, sasabihin mo, drink it with calamansi juice or pineapple juice. So, vitamin C deficiency presents as scurvy, sore spongy gums, loose teeth, no? Poor wound healing and bone fracture. Finally, biotin. So, biotin, vitamin H, isa lang tatandaan nyo, no? So, vitamin E is a carrier of carbon dioxide. It binds to the epsilon amino group of lysine in biotin-dependent enzymes. So, tatlo yung biotin-dependent enzymes. 1, 2, and 3, you see them on the slide. Number 1, pyruvate carboxylase. Number 2, acetyl-CoA carboxylase. Number 3, propionyl-CoA carboxylase. Kaya pag carboxylation reaction, biotin. Or let's review. Saan si pyruvate carboxylase? Pyruvate carboxylase converts pyruvate to oxaloacetate. What pathway? Gluconeogenesis. Acetyl-CoA carboxylase converts acetyl-CoA carboxylase to malonyl-CoA. Which pathway? Fatty acid synthesis. Propionyl-CoA carboxylase converts propionyl-CoA to pentyl-malonyl-CoA, which is in the metabolism of fatty acids with an odd number of carbons. Diba? Para maging glucose ulit siya. Deficiency is rare, but avidin found in egg whites can cause vitamin H or biotin deficiency. Pero para magkaroon ng biotin deficiency, kailangan daw, you need to eat 20 egg whites. At hindi lang 20. Dapat raw. 20 raw egg whites. So this almost never happens. Specific test for vitamin deficiencies. So ito, tinatanong nila to, no? So, erythrocyte transketolase. So, transketolase assay will help you determine kung may vitamin B1 deficiency. Because remember, transketolases require thiamine. Transaminase assay naman, vitamin B6 because transaminases require vitamin B6. Methyl malonic acid test, Schilling test, requires vitamin B12. So, vitamin B12 yan. Tapos, finally, formiminoglutamate excretion test or FIGLU excretion test. So, what do we do? Papakainin natin siya ng histidine. The patient is asked to take in histidine. Tapos, i-measure natin yung levels ng FIGLU. No? So, kapag meron tayong folate deficiency, tataas yung levels ng FIGLU. No? Tataas yung levels ng FIGLU. Yung formiminoglutamate. No? Okay? Finally, for minerals. No, yung minerals, from time to time lang nila ito tinatanong. No? So, usually, ang specific enzymes lang yung tatanungin nila or which pathways. Iron, the most important mineral in the body. So, pag tinanong kayo what's the most abundant, most important, it's iron, about 3 to 4 grams. So, remember that the storage form of iron is ferritin. No? This is the more abundant storage form when tissue stores are low. But when yung hemosiderin, yun naman yung iron overload. No? Ibig sabihin, kapag sobra-sobra naman yung iron. The transport protein in plasma, if you need to transport iron, is transferrin. So, kulang sa iron deficiency anemia. This is the most common micronutrient deficiency worldwide. So, ano ba nangyayari? Pag kulang tayo sa iron, we first mobilize your stored iron. So, yung ferritin, bababa yan. Next, ang susunod na bababa yung hemoglobin. So, mako-compromise yung hemoglobin synthesis. So, kaya mag-iron deficiency anemia. And then finally, kung kulang ka na talaga sa iron, then yung mga enzymes na that require iron, yun na yung ma-affect. No? So remember, laging ganun, no? So yung pinaka-less, yung mga less important functions, yung muna yung unang nawawala. Kaya dito sa iron, yung last na mawawala, yung iron-containing enzymes. Okay, so iron deficiency anemia, tandaan nyo yung profile, no? So decreased plasma iron, decreased transferrin, decreased ferritin, but increased TIBC. In hemochromatosis, you have iron overload. So when you have iron overload, ang nangyayari naman dito, no? You have hemosiderosis, iron buildup in the organ. So pwede magka-liver cirrhosis. This is seen mainly in older men kasi walang menstruation. So you will see here, increased, baligtad siya sa iron deficiency. Increased plasma iron, increased transferrin, increased ferritin, decreased TIBC. Treatment, just give blood every so often. After iron, the next most important element is zinc. Important yung zinc because it is a cofactor of many enzymes. So you will see here, alcohol dehydrogenase, DNA and RNA polymerase. It is also important for wound healing, no? It is important for wound healing. Kaya nga, no, pag may mga patients, no, kapag mayroon silang bad wounds, like yung mga plastic surgery patients, binibigyan niya ng zinc supplementation. Okay? Zinc finger protein, maririnig nyo rin yan, no? So it's a component of these proteins. Zinc deficiency, what will happen? If you have zinc deficiency, you will have dermatitis and poor wound healing with hair loss. Now, look here. This is acrodermatitis enteropathica. Acrodermatitis enteropathica, dermatitis, diarrhea, and very characteristic alopecia. See that? So, pag nakakita kayo ng case, binigyan kayo ng case, dermatitis, diarrhea, alopecia, zinc! Ang sagot dyan. Okay? This is because of impaired intestinal zinc absorption. And the way to treat this, you give high dose of oral zinc. High dose of oral zinc. Copper, 80 to 110 milligrams in the body. Just like zinc, it is also a cofactor of several enzymes. No? So, lysyl oxidase, no? Superoxide dismutase, dopamine hydroxylase, tyrosinase enzyme. No? So, babalikan nyo lang itong mga to. The transport protein for copper is ceruloplasmin. So, if you have copper deficiency, how does it manifest? Copper deficiency manifests with anemia. So, ang nakakakuha nito yung mga naka-TPN. Tapos yung mga infants with copper deficient formula. Pag kulang sa copper, no? Pag kulang sa copper because of decreased absorption, it's Menkes syndrome. Kinky hair, yun yung keyword dito. Kinky hair or brittle hair and mental retardation. So, pag kulang ang copper, Menkes syndrome. Kapag sobra, Wilson disease. No? So, you see this? Ito yung Kaiser-Fleischer ring. You have excessive copper. Ang tawag doon, Wilson disease, hepatolenticular degeneration. So, ang manifestation niyan, liver and brain. So, yung lenticular nucleus kasi ng brain yung affected. So, liver damage and neurologic deterioration. Treatment is penicillamine, which helps bind copper para ma-excrete natin siya. Trace elements, manganese. Ito mga nice to know. Manganese madness. So if you have excessive manganese, no, para siyang psychosis and Parkinsonism, manganese can be replaced by magnesium in most cases. Molybdenum, xanthine oxidase. Xanthine oxidase we will learn in the last topic, non-nucleotide metabolism. Tandaan nyo lang, molybdenum, xanthine oxidase. Selenium, ito yung medyo favorite nila. Kasi selenium is important for glutathione peroxidase, no? For you to neutralize hydrogen peroxide to water, no, free radicals, no, you need to convert. You need selenium, no, glutathione peroxidase. So reduced to oxidized glutathione. Kishan disease is low selenium. This is found in China. Iodine is for your thyroid hormones. And of course, fluorine fluorine is not actually absolutely essential, but it can be it is incorporated in the inorganic substance of bone and teeth. So in summary, insulin and glucagon have opposite effects during the absorptive and post-absorptive states. Just recall their differences, what pathways are activated, and then try to remember their effects on the key enzymes. Different organs activate specific pathways to meet their needs, depending on whether you're well-fed, or fasting. Pinaka-important, of course, will be liver, which provides fuel and other tissues during fasting. Finally, deficiencies of vitamins and minerals in the diet may cause disease due to disruption of biochemical pathways. In excess, they may also be toxic to the human body. Thank you for listening to this lecture.